I think AstraZeneca, it was very clear worldwide, all the leaders in AstraZeneca, when we made this decision as an organization, very clear yung mission, make the vaccine available in as many countries as possible. In fact, worldwide, we have released 3 billion vaccine doses, and that's to 180 countries. And most of these countries are low to medium income countries, no, including 39 million doses delivered to the Philippines. So there was a shared commitment to global equitable access in the organization. But of course, the model was very challenging. Diba? So ang maganda nito is we really saw people wanting to come up with a solution, multiple parties, no? And it was, since there was no playbook, we were all trying to find a solution. The key was, people with common goals, right? Mr. Joey Concepcion, Ms. Tessie Coson, all the private sector that came together. And then you have all the local government units really wanting to secure. And then, of course, with the support of the national government. No? So, nabuo siya. Nabuo yung model. Of course, it's easy to say now, but it took a lot of, sleepless nights and a lot of coordination. But we were very clear kasi we don't want Philippines to be left behind. Diba? We had to get access. More importantly, Sito, with our global supply to the world, AstraZeneca has saved 6.3 million lives globally. And in the Philippines, we have prevented more than 52,000 deaths through the vaccination. And diba, at the end of the day, lives. We're talking about lives here. So that makes it very meaningful because all the collaboration, it led to something.
I know for a fact that in the United States, there were brands or manufacturers who were under pressure from government. Na parang, hello, we have an international commitment, and then the U.S. government was saying, us first before others. So that was an issue for many pharmaceutical executives. Now, moving forward, so you managed to work with private sector associates, with the government. You managed to put together a group to bring in the vaccines, save lives, etc. But how is the situation now? Because I recently read, I think it was yesterday or the other day, where I read an article that expressed frustration on the part of health services that the Filipinos parang okay na kami, we already did 1 or 2, we're bulletproof already. What is the sentiment of your group or yourself regarding this?
Well, of course, we continue to support the drive for vaccination, regardless of what supply is in the country, largely because the virus is evolving, right? And the fact is that in the country, only about 20 million has the first booster dose, right, which is quite low. And so it's important to continue to drive this campaign, which I know the Department of Health is also driving. And it's important to note, Sito, that the WHO Strategic Advisory Group recently released a statement that says and recommends countries that have used both inactivated or mRNA as primary doses to continue to use viral vectors such as AstraZeneca vaccine or mRNA as a booster dose. So it's about really encouraging more people to get boosted because the virus is evolving and we have to continue to stay ahead of the virus. So yun yung kailangan talagang pagtulong-tulungan na drive as a campaign.